Hey guys, welcome to my channel. Today I'm going to discuss a very important topic that is postmortem lividity. It's also known as postmortem staining, liver mortis, sigulations, or vibices. So we can call postmortem lividity as these four names, right? Okay, let's start. Bluish purple discoloration of the skin after death is known as postmortem lividity. The definition is seen in dependent parts of the body. What the dependent parts means? The parts which touches the ground or which are in the contact with the ground are known as the dependent parts. It is seen in dependent parts of the body as a result of stagnation and collection of blood in the capillaries and veins due to gravity. And what is the mechanism in seen? Stagnation of blood after death, followed by collection of blood in the capillaries and veins due to gravity. Okay, next site. Dependent parts of the it's mainly seen in the dependent parts of the body. As I already told, dependent parts are the parts which are which are contact into the ground. When the body is laid on the on the surface, the parts which are in the contact with the ground are known as dependent parts. If the body is hanging, postmortem lividity is seen in hands and feet, etc. So in these cases, as the body is hanging, the parts which are close to the earth, which are more prone to the gravity, which has a more effect of gravity, in that parts we can see the postmortem lividity. If the body is supine, postmortem lividity is seen in the back of the neck, back of the thorax, buttocks, flanks, and posterior aspect of thigh, calves, and heels. These are the parts which are in contact. This is the image. See the postmortem lividity image. So the parts of contact in the ground. So in these parts, we are going to say the stainings. If the body is prone, postmortem lividity is seen in front of the chest, face, and eyes. If the body is lying on one side, lividity is seen on that side. Yeah. Any pressure prevents the filling of capillaries. Areas such as collar, around neck, waist bands, bells, and wrinkles in the clothes are seen as pale bands and are also known as ribices. So all these like neck bands, bells, and wrinkles is prevent or causes pressure and which forms ribices. Right? I hope it is clear. And next, wait, just a minute. Okay. Yeah. I hope it's clear, visible. Yeah. Okay. Um Blanching, also known as pallor, is also caused by pressure of one part of the body over other, in which case mirror image blanching is seen. Body areas in contact with the floor or ground also show blanching, known as contact pallor. Right. Next, uh, development of lividity. So it is well developed within 4 hours and persists until petrification sets in. So within 4 hours after death, it is developed and it is present and persistent under putrefaction sets in. Intensity is more in death due to asphyxia. Intensity is less in death due to anemia and hemorrhage. Patchy areas unite to produce extensive discoloration. Dull red patches of 1 or 2 diameters appear in half to 1 hour. 1 to 4 hours increases intensity and become a confluent. 6 to 12 hours maximum intensity and maximum extent. See the graph. You can draw the graph in the exams where you can see um, where the postmortem lividity increase begins within 2 hours. It is well developed within it begins within 2 hours and well developed within 4 hours and stays within still putrefaction occurs. So it's very important. Begins within 2 hours and develop within 4 hours, well developed within 4 hours, and states still putrefaction occurs. Right. Next, shifting of lividity. If the posture of the body is changed within few hours after death, lividity shifts to new dependent parts. It is known as secondary lividity or shifting of lividity. Shifting may be complete or incomplete. So this is what shifting of lividity. So if we change the posture of the body, then the lividity the shifts, right? Next, fixation of lividity. Lividity cannot be shifted So here we can shifting of lividity occurs like okay. Then here in this the lividity postmortem lividity does not shift. There is no fixation of lividity. Lividity cannot be shifted after 6 to 12 hours. If at all, if you change the poster before 6 hours or 6 hours, then shifting of lividity occurs. But after 6 hours, then the lividity is fixed. It can't be changed. This is no fixation of lividity. Lividity cannot be shifted because blood cannot pass out of the blood vessel due to hemoconcentration. Rigor mortis obliterates blood vessels and blood leaks into surrounding tissue due to hemolysis. So these are the cases why the lividity is fixed and it can't be shifted. Next, this is very important. Color changes in lividity. So, what are the color changes you see in lividity? If the person dies due to asphyxia, then the color changes are then bluish purple. If the person dies due to carbon monoxide poisoning and cherry red color, lividity is C. Hypothermia, then pink color, hydrocyanide poisoning, bright red color, and Clostridium perfringens infection, bronze color, Clostridium welchi, grayish color, phosphorus and nitrate, brown color, and septicemia, greenish color. The decomposition is black. So there's a very important color. This indicates based on the lividity color of the lividity, we can say the cause of the death. So yeah. So differential diagnosis, we can differentiate it. We have to differentiate it from the bruise and the congestion. So here the table like difference between the hypostasis and congestion. So in hypostasis and congestion, see appearance in hypostasis bluish purple and irregular patchy, and congestion redness is uniform all over the parts. Next, mucous membrane is dull and lusterless. It is in congestion is normal. Exudate is absent in hypostasis and it is normal. Sorry, it is present. In exudate is absent, it is present. And hollow viscous like stomach and intestine show already stain and unstained areas. Here, uniform staining. In congestion, you can say uniform staining. In hypostasis, here alternate stain and unstained areas are seen. Next, what is in every question in forensic, in every whatever may be the question, you have to write the medical legal importance. What is the medical legal importance? The medical legal importance here are the sign of death, approximate so there's a sign of death, right? Next, approximate estimation of time since death. So based on the lividity, like we can say when the person has time since death, we can say because after 6 hours, the lividity, the fixation of lividity has seen. If in a body has seen the fixed lividity, then you can say the body has died. Like it has been 6 days, 6 hours that the body has died. The person has died. So based on that, we can say the time since death. It indicates the posture of the dead body because we all know that the lividity is seen mainly on the Mm, a pressure point. So by seeing the lividity, we can say in which position the body was there and the body was kept. Indicates shifting of dead body. So during the shifting of dead body, we can say shifting lividity. So based on that, we can say how they had shifted the body and all. Different colors indicates different types of poisoning. So as already mentioned, the different colors that are seen during lividity. So based on the colors, we can indicate the cause of death and all. So it's a very important question. So please read and thank you so much for listening. Bye.